What are the risk factors for starting cervical cancer screening? When considering cervical cancer screening, it is important to understand the various risk factors that can influence when to start. Cervical cancer screening is primarily based on age and individual risk factors related to the development of cervical cancer. Generally, screening is recommended to begin at age 21, regardless of sexual activity. This is because cervical cancer is very rare in women younger than 21, and screening at this age can lead to unnecessary procedures. One of the main risk factors for cervical cancer is human papillomavirus, or HPV, infection. HPV is a sexually transmitted infection and is the leading cause of cervical cancer. Therefore, screening is advised for women who have been sexually active. However, it is crucial to note that screening does not start before age 21, even if sexual activity begins earlier. Another important factor is a history of cervical precancer or cancer. Women who have previously been diagnosed with cervical intraepithelial neoplasia, grade 2 or 3, or cervical cancer, may need to start screening earlier or undergo more frequent screenings. Immunosuppression is also a significant risk factor. Women with weakened immune systems, such as those living with HIV or organ transplant recipients, face a higher risk of persistent HPV infection and cervical cancer. This may necessitate earlier or more frequent screenings. Other risk factors include smoking, long-term use of oral contraceptives, multiple full-term pregnancies, and a history of sexually transmitted infections. These factors can elevate the risk of cervical cancer and may influence when a woman should begin screening. Current guidelines recommend starting cervical cancer screening at age 21 with a Pap test every 3 years for women aged 21 to 29. For women aged 30 to 65, screening can be done every 5 years with high-risk HPV testing alone, every 3 years with Pap testing alone, or every 5 years with COAT testing, which includes both Pap and HPV tests. It is generally not recommended to screen before age 21 or after age 65 if prior screenings were adequate and there are no high-risk factors present. Women who have had a hysterectomy with removal of the cervix and no history of high-grade precancer or cervical cancer typically do not need screening. These recommendations are designed to balance the benefits of early detection with the risks of overscreening and overtreatment. It is also important to remember that HPV vaccination does not eliminate the need for screening, as it does not protect against all high-risk HPV types. In summary, the main risk factors for starting cervical cancer screening include age, sexual activity due to HPV exposure, and individual medical history, including immunosuppression and prior cervical disease. Screening intervals and methods are tailored based on age and risk profile to optimize early detection while minimizing harm. Always consult healthcare professionals for personalized screening plans.